Thank you for joining me today. In this video, you will learn INVEGA. What is INVEGA? INVEGA is a second-generation antipsychotic medication called a typical antipsychotic medication. It's FDA-approved for schizophrenia, and it improves both negative and positive symptoms of schizophrenia because it blocks dopamine in D2 receptor and it blocks serotonin. So it has these two effective. So it is primarily excreted in the kidney, and INVEGA it has a tablet and extended relief. It's approved schizophrenia in adult and teenagers between 12 to 17. Also is approved schizoaffective disorder. It can be used monotherapy or it can be added to mood stabilizer and antidepressant medication. However, it has a black box warning. What is the black box warning? It increases mortality in older patients with dementia-related psychosis. Classic effect. Not approved for this population. So it's not approved for older adults with dementia. INVEGA has oral extended relief tablets that used daily. It also has monthly long-term injections. It has also every 3 month long-term injections. It also has every 6 month long-acting injection. Each has different initiation requirements and requires by prior stabilization on a SUSTENNA and TENTA. They have names. There is a SUSTENNA, there is INVEGA SUSTENNA, there is a INVEGA TRINZA, there is a INVEGA HAFYERA. So one is 1 month, one is 3 months, and one is 6 month injection, long-acting injections. So oral INVEGA for adult with schizophrenia, you will start 6 milligram orally once a day, and it ranges between 3 to 12 milligram daily. Maximum is 12 milligram daily. Schizoaffective disorder in an adult will have the same dose as a schizophrenia. Teenagers between 12 to 17 years old is weight-based dosage. So you will calculate that weight dosage. Less than 51 gram will be between 3 to 6 milligram daily. Greater than 51 kilogram, not milligram, kilogram, will be 3 to 12 milligram daily. So it's based on weight. You will calculate the dosage based on weight. Starts with 3 milligram to 12 milligram based on the teenager weight. So extend release tablet must be swallowed whole. Do not chew or do not crush, do not chew, do not split. That is the requirement. The key surface effective is very testable. It creates hyperprolactinemia, galactorrhea, sadness, and sexual dysfunction. It also increases EBS, extrapyramidal symptoms. It increases weight gain and metabolic symptoms. It has a sedation and dizziness side effects. And the serious side effects include QT prolongation, and it can lead to heart failure. It also it can cause Neuroleptic Malignant Syndrome. It can also cause tardive dyskinesia and orthostatic blood pressure, so it can lower your blood pressure. Cerebral vascular events in orderly, so it can cause stroke, heart failure. It can cause Neuroleptic Malignant Syndrome. It can cause EPS symptoms. You want to monitor a baseline and ongoing weight, BMI, waist circumferences, fasting glucose, and A1C. You want to monitor the liver blood pressure. You want to also monitor EPS symptoms using Ames, Simpson, and NC if indicated. Also cardiac, you will check the EKG if the patient has a history of cardiac disease. Abnormal electrolytes, you want to check the QT prolongation. Other medication is you don't want to combine this INVEGA with other medication that has QT prolongation. You want to check the endocrine for prolactin level if indicated. You want to also monitor a kidney function. Critical dose adjustment required in a kidney impaired patient because this medication is excreted in the kidney. INVEGA primarily is excreted in the kidney, so reduced dose in a mild to moderate renal impairment required. Avoid or use caution patient with lower kidney function, especially with the long-term injections. Contraindication of this medication include hypersensitivity to INVEGA or risperidone, dementia-related psychosis, that is the black box warning, education and clinical borrow. Good option is when hepatic impairment limits other antipsychotic medication. Expect prolactin elevation more than with the aripiprazole and Seroquel. So this has a more prolactin elevation than Seroquel or aripiprazole. Long-acting injection forms dramatically improve medication adherence, but require oral bridging rules. There's a rule that you have to bridge first. You will start the patient with oral medication and then you will bridge them to long-acting injection if that needs to be. Similar to profile to risperidone, but slightly less hepatic drug interaction. So the patient education include take this medication once a day at the same time. Do not crash or chew the tablet. Report muscle stiffness, fever, irregular heartbeat, abnormal muscle movement, and expected possible weight gain or hormonal imbalance. Regular labs are important. Regular lab monitor is important. Okay. Thank you for joining me today. I would love to see you in my next video. Thank you.